Christmas is almost here, but the spread of the Omicron variant is putting a damper on holiday cheer. Last-minute Christmas Eve travelers have been getting bad news. More than 2,000 flights worldwide have been canceled. United Airlines blames rising Omicron cases, saying they've had a direct impact on flight crews and other staffers. So far, United has canceled more than 150 flights. Meanwhile, the U.S. is averaging over 164,000 cases and more than 1,300 deaths per day. Yesterday alone, over 3,300 deaths were recorded. The rise in confirmed COVID cases will keep some families apart during this holiday, and it's adding to the stress nationwide. To give us some advice on all that, let's bring in Dr. Daniel Bober. He's a psychiatrist and certified addiction medicine physician. He's also a former mental health policy fellow for the U.S. Senate through the American Psychiatric Association. Dr. Bober, Merry Christmas.
It was great to be here.
Well, let me just ask you, a few weeks ago, Americans were excitedly making plans to spend this holiday with their family and friends. Now, some are having to change those plans because of the rising Omicron cases. What are some tips that you can give to people who are coping with the change in plans or who are now spending the holiday alone?
Well, you know, with the stress of the holiday and all these new potential lockdown restrictions, it's all been too much to bear for a lot of people. But there are things that we can do to try to combat this situation. It's very important to set appropriate boundaries during the holidays. For example, if there are people that you don't get along with or certain family members, it's very important to sort of leave those people to the side and not touch on these hot button topics that get people all worked up. The other things that you can do are exercising. It's very important to exercise. Exercise is one of the best antidepressants that there is, and it's natural. And then finally, volunteering. Volunteering is important, giving service to others and rising above yourself. And let's not forget a gratitude list, writing down a list of things that you're grateful for in the past year. These are all very important things that you can do to try to help your own mental health during the holidays.
Little gift to yourself. It's one thing for people to experience general stress and anxiety over the coronavirus, but it's another ballgame if you can actually test positive. So how can people who actually do get sick with the virus help themselves mentally as they try to recover?
Well, it's very important to stay connected to the ones you love and care about. You know, it's going to be very hard if people are sitting around on a holiday table and you're all alone in your house isolating. So it's important to try to stay connected to those people and to reach out to the people that we think are doing fine, because sometimes they're putting on a good front and they're not really doing fine. So it's important to check in on the ones you love and stay connected.
You know, Doctor, we're 2 years into this pandemic now, and Americans are feeling more and more burnt out. But Omicron is now spreading, and health officials want everyone to take precautions seriously. So what advice can you give to people who are trying to balance their health with living their lives again?
So I think when this thing started, you know, we were in survival mode, sort of fight or flight, if you will. But now I think at this point, we're just tired, we're frustrated, we're fatigued over this whole thing. And so I think it's important to try to not live your life in a bubble, not go out there and do, you know, things that are not using common sense, but still go out and try to live your life, but still wear a mask, obviously still get vaccinated, but not to isolate yourself completely. So I think we have to strike a balance between our own personal freedom, if you will, and public health, and try to move forward and live our lives with this new normal now.
Doctor, one symptom of this stress may be this statistic. The CDC reports over 100,000 drug overdose deaths, I should say, from April 2020 to April 2021 during the first year of the pandemic. That number is much higher than the previous year. So what should we take away from that staggering statistic?
What we should take away is that COVID is a disease of loneliness. Addiction is a disease. It's a brain disease, just like any other disease, whether it's heart disease or cancer. And when people are dealing with addiction, they are cut off from the ones they love. And because COVID isolates us so much from people, it is causing people to feel less connected, more isolated. And as a very practical matter, if they overdose, there's no one there to save them, no one there to, for example, give them the drug naloxone, which can reverse opioid overdose. So I think COVID is a disease of loneliness, and we have to try to stay together to the greatest extent possible to combat this wave of overdoses.
Doctor, one other question for you. You know, there are some major differences of opinion when it comes to dealing with the pandemic. Some families and friends will still gather for the holidays. So what's your advice for gatherings if and when those conversations around topics like mask wearing or vaccines come up and there are disagreements?
Well, as I said in the beginning, I think there are some topics you have to just try to leave alone. You know, I think if someone is hosting a party, you know, they have to be obviously conscientious about COVID. Maybe there's things that we can do to make it easier. Maybe we can have a meal outside on the patio with some space heaters. Maybe we can have less people in a room or spread out more. Let's try to find a way to make it work so we can all have Christmas and enjoy this year together.
Good advice to carry on this Christmas. Dr. Daniel Bober, thank you and Merry Christmas.
Merry Christmas. My pleasure.